There are certain problems which are peculiar to old age. One among them is fall. It commonly happens to the elderly people that they fall that get injured. Even though fall is a common problem which can happen to any people at any age, the frequency of such falls is more in the elderly population. There are various reasons to it. One among is the medical condition of the patient, such as they may have arthritis, hip muscle weaknesses, certain neurological disorders, and BP and sugar fluctuations, or sometimes vision disturbances, hearing disturbances, and certain medicines also can cause certain side effects which can cause giddiness and they can fall. Next is poor diet and lack of exercise, which can lead to bone and muscle weaknesses, and in turn which affects the coordination and balance of the patient. Apart from the increase in the frequency of such falls in the elderly, the severity of such falls is also more in them. At times it so becomes that it becomes a life-changing event in their life, as it deprives totally of their independence and they'll have to depend on their family members lifelong. Also the immediate treatment and the post-treatment measures that we have to take, it is a very cumbersome process, and it's a difficult process for them also, and also for the caregivers to undergo. Considering all this, it becomes very important that certain preventive measures are taken so that we can minimize such falls in the elderly population. First and foremost of this is attending to the medical condition of the patient, like taking them for regular reviews with the concerned consultant, and doing a periodical eye checkups on them. And next is giving importance to the diet. Proper nutritious diet has to be given to them, especially concentrating on calcium, vitamin D3 and proteins. And whenever possible, calcium and vitamin D3 supplements has to be given to them to strengthen the bones and muscles. Next is doing mild exercises, at least in the form of 20 minutes of walking in a day, because it will improve the bone strength and coordination and balance of the elderly people. And next is the most important measure that has to be taken, that is doing certain changes in the living places of the elderly. Like you can improve the lighting in their place where they live, like especially in the bathrooms and the staircases, and we can keep the furnitures well arranged so that they have more space to move about, and they can prevent falling down. And you need to keep the floors dry, clutter free, and non-slippery. And also these mats which we use commonly at homes has to be very stable mats, because mostly they skid in the mats and fall down. And we need to provide them with a torchlight handy so that in case of power cuts it will be useful to them. And especially in the bathrooms, we have to be careful with the mats, and always we have to be very careful that stable mats are provided to them. And whenever possible, toilet seats with armrests can be provided for extra safety. And if possible, side walls can be fixed in the side bars can be fixed in the walls, so that they can get in and get out of the bathroom safely. If these precautions are taken, elders can lead a very safe life instead of suffering from head injuries, hip fractures and forearm fractures, which commonly occur after a fall. It's after all our duty to take care of the elders, since they have had a very long life, and they have served the family and the society